ตอนนี้เราเข้าสู่ช่วง Med in Focus กันแล้วนะคะซึ่งเดี๋ยวตอนนี้เราจะทำการไลฟ์นะคะเราไลฟ์กันอยู่ด้วยวันนี้เราจะมาพูดถึงท็อปิกที่คาร่าว่ามันเป็นท็อปิกที่ใกล้ตัวมากๆเลยนะคะถึงเรื่องการนอนนั่นเองค่ะ metster เชื่อเลยว่าหลายคนเนี่ยอาจจะมีปัญหาในเรื่องของการนอนเดี๋ยวคุยนะคะกับดร.พจนิชาเมฆอรุณกมลนะคะจากโรงพยาบาลกรุงเทพค่ะและนอกจากนี้แล้วเนี่ยวันนี้นะคะถ้าใครดูอยู่เนี่ยเราจะเปิดโอกาสให้ metster มาลุ้นของรางวัลกันได้นะคะเป็นวัคซีนนะคะเป็น quadrivalent influenza shot 2 รางวัลเลยนะคะแชร์ไลฟ์เปิดเป็น public แล้วก็ทิ้งคำถามไว้นะคะใครเหมือนตอนนี้ฟังอยู่แล้วแบบมีปัญหานอนไม่หลับเลยนะคะเดี๋ยวมาฟังกันนะคะตอนนี้ขอต้อนรับเข้าสู่ช่วงMed in Focus ค่ะ
Med in Focus
Guys, we're back once again to the Med in Focus, and today's topic is about sleeping matters. Insomnia can happen to anyone, and today we are going to be talking to Dr. Pojnicha Mekaroonkamol, Managing Director, Internist and Sleep Specialist at Integrated Care Center at Bangkok Hospital. Not only that, we will be discussing today's topic, we will be giving out 2 e-vouchers of the quadrivalent influenza vaccine. But for now, สวัสดีค่ะ
สวัสดีค่ะ
สวัสดีค่ะ Dr. พจนิชา
Yes, you actually can call me Dr. J. That's,
Dr. J.
Kind of more casual.
Okay, Dr.
DJ Carla.
Hi. How are you?
I'm good. How are you?
I'm great. I'm great. And this is a very interesting topic because I myself had sleeping problem last night.
It's very common. It's very common for, these days, where you have stress and, life kind of moves really fast.
Right.
So it's getting harder and harder for people to sleep.
Right. And also having a daughter sleeping next to you and then, maybe
of course.
Kicking you here and there a bit, it really disturbs my sleep. So let's get to know about insomnia and sleeping matters today. I would like to know 3 key facts about sleeping.
All right. So, sleep matters. I would like to start with the topics today.
Yeah.
It matters because if you think about it, everyone spend about 7 to 8 hours sleeping each day. Mm-hmm. And that's equal to what? Almost a third of your life sleeping.
Right.
So that affects, of course, a lot of your health. And it doesn't only affect your health or performance or your symptoms during the night, but also it affects your daytime performance as well.
Right.
All right.
Definitely.
I would like to go into the 3 interesting facts about sleep. Number 1 that I list here is dreaming is vital. I find this interesting because a lot of time I heard people ask me whether, hey, I dream so often. Is there something wrong with me? And the answer is actually no. Everybody dreams every night several times. It's only if you remember it or not.
Right.
From the picture that I show here is a normal sleep cycle for 8 hours sleep in normal adults.
Right.
So as you can see, our brain activity would flow throughout the night, range from stage 1, 2, 3, and 4, meaning light sleep, deep sleep, and REM sleep. REM stand for rapid eye movement, which is the dream sleep. So as you can see here, people dream like 4 to 5 dreams each night. And what happened during dream sleep is that you have the memory consolidation. You would turn the short-term memory into the long-term memory. So it's very important for our brain function. And, that's why I say dreaming is vital and there's nothing wrong with dreaming at all.
Right. Right. Okay. So when people say that I dream, but I'm not sure, they're actually dreaming.
Yes.
Right.
They are dreaming. Sometimes they dream and they wake up and they don't remember and they say, oh, I didn't dream last night, but they did actually.
Oh, okay. Right. And next with
All right. So fact number 2, longer sleep is not equal to better health.
right.
So the reason I say this is because I want you to focus more on sleep quality rather than sleep quantity. I did mention about, adult would sleep about 7 to 8 hours a night.
Right.
And yes, that's true. However, even if you do get 7 to 8 hours, but if those hours are poor quality, it's still, not good for your health.
Right.
There are ways to pretty much evaluate your sleep quality. People would think that maybe, do I need a sleep study to see my sleep quality?
Yeah.
Yes. Sleep study will give you objective evidence and, more detailed information about your sleep quality. But in fact, everyone can simply evaluate their sleep quality by just, see your total sleep time, how long does it take for you to fall asleep, whether or not you can stay asleep, or maintain your sleep. And also when you wake up in the morning, if you feel refreshed or if you feel ready to start the day.
Right.
Also during the day, do you feel sleepy all the times or groggy, or you feel like you don't have any energy to work? So those are signs that, you might not have good quality of sleep.
Right. Okay. It makes sense now because some of the days when I wake up and I feel I slept for 4 hours, but I feel fresh. I thought it's weird. And then some days I sleep for 10 hours and I'm so tired and I feel like I haven't slept enough and I need more sleep.
Definitely. And it's super understandable for, a mother who has to sleep with the baby, would have kind of a lot of disruption during your sleep. So even though you get long hours, you will still feel tired in the morning.
All right. And key number 2?
That was number 2.
Oh,
so number 3 is sleep aid may not be the answer for insomniacs.
Right.
So I think, the most common question I get when I see a patient in the clinic for insomnia is that, okay, well, if I get the sleep aid, would I get addicted to it, or how long do I need to stay on it for? And that's why, I want to say that when we evaluate the patient who present with insomnia, we don't just, throw the sedative at them. We want to take a detailed history and see, what is the real cause, what is the real disorder that they have, because a lot of sleep disorders can present with insomnia and the treatment is actually not the sleep aid. I would like to, give you some example of the sleep disorder that actually people present with insomnia, but they shouldn't be treated with sleep aid. For example, people who have restless leg syndrome, that's the disease of, you would feel kind of discomfort or, uncomfortable in the legs, and actually the feeling is growing towards the evening time. You will feel more symptoms during the evening, during the night.
Right.
You lie in bed, you try to go to sleep, you feel uncomfortable in the legs, and you think, oh, I can't go to sleep.
Right.
But in fact, to treat restless leg, you want to check if they have any medical condition that promote the disease. For example, iron deficiency is one of them. Kidney disease is another example.
Right.
You would treat those conditions to get rid of restless leg, and this insomnia will just go away without giving them sleep aid at all.
Right. So when we're talking about sleep aid and everything, how do we diagnose and treat sleeping problems that people have nowadays?
Like I mentioned before, detailed history is the key. So when we evaluate patient in the clinic, we would ask them in very detailed information about, what time do they go to sleep? Do they go to sleep at the same time every day? What's the routine between weekdays and weekends? How long does it take for you to to fall asleep,
right.
and whether or not they can stay asleep. Do they drink coffee? Do they drink alcohol? Do they smoke? And how do they feel during the day? There will be questionnaires for them to fill out, and we can evaluate how much sleepy they feel during the day. And those are pretty much information that we will need. We would do physical exam, looking in their throat, measure the neck circumference to see if they have risk for sleep apnea. And of course, the final point would be sleep study. There are two big types of sleep studies. One is the home test that people can do it at home.
Oh.
And the second one is people will have to come to the hospital and spend a night in the hospital. And, you'll be monitored for several things. I would like to focus on the one that we do in the hospital. You will have your brain wave monitoring, your heart, your oxygen level, your movements, your chest and abdomen movements. So that will give us a lot of information about that person's sleep.
Right. Wow. We learn a lot. So metsters, if you're listening right now and you know that you're having sleep problems or you're experiencing insomnia, having sleep deprived, so don't forget to go to Bangkok Hospital, get tested. Let's, get rid of insomnia. Thank you so much, Dr. J, for educating us. But we will continue this in depth in our Facebook Live. But for now on air, we're going to have to say goodbye to you.
Alright สวัสดีค่ะ
We'll see you in the Facebook Live นะคะ All right, but before we sign out on air today, would like to thank you, Dr. J and Bangkok Hospital. But before we leave, hello, sawadee to a healthier you. Bangkok Hospital is here. Everyone is unique, and so is your health. Explore comprehensive healthcare services best suited for you and your lifestyle. Tailor your life and design your health at Bangkok Hospital, where advances in medicine meets with compassion. คุณหมอได้ยินไหมคะ
ได้ยินค่ะ
Okay, we're gonna be talking in depth, and I think we have questions from our listeners coming in as well from คุณ Sopanat Punpruk. He's saying, could you please recommend a decent technique for good sleep quality with limited sleeping hours, such as only 6 to 6.5 hours?
Okay, well, you might have already heard this word so many times, sleep hygiene, meaning that you want to prepare the environment and also your habit as well to promote sleep, meaning to make it the easiest for you to fall asleep because you have limited time, so you don't want to waste your time just lying awake in bed. So number one, caffeine intake. Normally, I don't recommend any caffeine intake after noontime. And, keep in mind, caffeine can come from different sources, not only coffee. You can get it from sodas, even from like decaf beverages.
Oh, really?
Even it's the decaf? Caffeine-free, but it has less caffeine than normal coffee. So number two, the environment in your bedroom, you want it to keep it kind of dark and cool, like right temperature for you.
Right.
And also with the noise should be quiet just for you to be able to fall asleep. And also, you might have heard about blue light. It's a certain kind of frequency of light that go into your eyes, to your retina, and suppress the release of melatonin, which will make it harder for you to fall asleep. And blue lights come from all the screens, your cell phone, the computer, the TV. So I know that our life, we can't live our life without our phone right now.
Yes.
These days. So there are certain like screen protector that kind of decrease the blue light that is sent out to your eyes. So that can be one thing that helps as well.
Right. When I have sleeping problems, I've been suggested to take to have like chamomile tea, those like sleeping teas and magnesium. Do you think that actually works? Because you were mentioning before that, even though those what is it? Decaf. It's not really. It still contains caffeine as well.
I think for the herbal tea, some of them don't have caffeine at all, so it's okay to use. But for me, I feel that what helps you sleep more easily from those things, even from like warm milk or some herbal tea, or actually the mood and the feeling of like, you know, that you make it kind of resting feeling and environment for you.
So
pretty much.
It's more of like a mood setting environment that you
exactly. Mood and tone.
We have another question from Kun Shannon Paternoster. He was asking, question, if you're addicted to tablets and you can't sleep, what should you do? Tablets, phone.
Yeah, I did mention about the screen protector that would cut out blue light. That's one thing that can help. And, you know, of course, I'm not sure, shouldn't give the information about what she does on the tablet, but of course we don't want to do things that is too kind of exciting, because you want, you know, the mood and tone to be very restful, so you don't want to kind of watch series that is very like exciting or scary. Also, you don't want to kind of play like online games that is like, you know, very stimulating, so those will not help you go to sleep.
Right. And what about those ASMR thing? Does it actually help with people falling asleep?
Sorry, I didn't hear you very well. What did you say again?
I've seen lots of people where they listens to all these white noise. Yes, white noise, ASMR thing. Do you think that it helps?
I've seen clips of those on YouTube.
Yes.
For some people it does help, because if they stay in the very quiet environment, their ears might start to hear like some tingling or tinnitus, that's what we call, and it kind of bothers them. So having white noise in the background would get rid of that weird noise that happens when they're in too quiet environments. So it might help for some people.
Okay, so it might help. Also, one more question I find very interesting from our listeners. Kun Bird was asking, what about taking melatonin pills? What's the recommended dosage?
Okay, so melatonin is actually recommended to be used short term. In fact, for condition that we really use melatonin is for jet lag, which means you use short term. The dose for jet lag is 5 to 10 milligrams. You take about an hour before you want to go to sleep. It will help you adjust to the local time in that time zone more easily. And the reason why it's recommended to be used short term is because your body have this condition called, well, the medical term would call it tachyphylaxis, which means that your body will get used to it, and it will stop responding to melatonin. For chronic use, there has been kind of approved indication to use melatonin long-term for chronic insomnia, but the dosage will be much lower, 1 to 3 milligrams a day. And yes, you will have tachyphylaxis, meaning that after you use it for a month or two, you will find that it's not working anymore. And the way to fix it is stop using it for about 2 to 3 weeks, start again, it will work again.
Right. I've been looking up on food that helps you sleep, such as almonds or like all sorts of things. How much would you say you would have to have those intake of food to be able to help you, you know, maybe fall asleep better or faster, or?
Like the food that I've heard would be like bananas. They have like serotonin. But I feel that if you're gonna eat certain things to have enough of the substance to make you fall asleep, it's gonna be actually not very good for you, because we don't want you to actually be too full when you go to sleep, because it might trigger your acid reflux or any of those things. I would say that what you want to avoid eating before you go to bed would be, things that, would stimulate your brain, like, things that have caffeine, things that are too spicy. And also alcohol is one interesting thing. Alcohol will make you fall asleep more easily, but it will not make you maintain the sleep. You will wake up after you already fall asleep.
So yeah, I was just gonna ask you that you mentioned no alcohol, but then I feel like with some people it's
you can
also
drink a small amount of alcohol,
like a glass of wine or two, is it?
Yeah, I would say a glass of wine would be a good amount of alcohol that you can take. Too much alcohol will actually suppress REM sleep that we already talked about in the beginning. So you will actually have less REM sleep during that night, which might make you feel kind of not very restful in the morning.
Right. So, working out. I would like to know more about working out. Let's say if we don't have time to work out in the morning, because they say morning workouts are the best. If we really don't have time and we have to do that, in the evening, what would you recommend would be the time to not go over? Let's say, what would be, how do I say this? Okay, when is the latest that you can work out so it doesn't really affect with...
Yeah, I get what you mean.
Yeah.
I would recommend about 2 hours before you go to bed to not exercise, because, your body will take time to kind of calm down, for your heart rate to go down, for your muscle to get relaxed. So about 2 hours before going to bed, you shouldn't exercise.
Right. So 2 hours and then 2 hours. And then after 2 hours, set up the mood, dim the light. And also, does cell phone data, like the service, the internet connection, does it really affect the way you sleep? Because I feel like at one point, there's like a screensaver or a phone protector where you can put your phone in and it doesn't interrupt you when you sleep.
I would say rather than the magnetic field that is sent out from the phone, it's more like the notification from the phone that would interrupt your sleep. For example, you might set the phone on like private mode or privacy mode that it will not vibrate or even ring if there's some text coming in. So that's what matters more, I would say.
Okay. We have more question. We talk about food that we shouldn't eat, but what are the food that you would recommend?
Well, you did mention almond.
Yeah.
I did say bananas, but like I said, I don't think that if you expect the result from the substance in those food, it's very minimal. So I don't think that it would help that much.
All right, you can take, but it's not going to help that much.
Right, and I actually do not recommend eating and then go to sleep.
Right.
You also 2 hours. You don't want to just go to bed right after you finish eating.
And another question from Kun Prayurapat is saying, one of my families facing with sleep problem in which some medical device is recommended to use at night, like every night. How does this help? Is it useful at all?
I think she's probably asking about like CPAP machine for people who have sleep apnea. And yes, I mean, sleep apnea is actually the biggest group of sleep disorders that we see in the clinic, and it's diagnosed from getting sleep studies, and we see the oxygen dropping, we see that the person stop breathing at night, and that actually can present as insomnia as well. People, when the oxygen levels go low, they stop breathing, their brain gets activated, and they keep waking up throughout the night. And the treatment, yes, sleep apneas come from the collapse of the throat, and it starts with the snoring, and then your throat gets narrower and narrower until there's not enough air going in and out. So the treatment would be the CPAP machine that blows the air into your throat and keep it open.
Right.
So this is the gold standard of treatment for sleep apnea people. But yes, you do need to see a doctor and get a sleep test in order to diagnose that.
So what if, let's say, you live alone and you don't have people sleeping next to you to be able to tell you that, hey, you know, you were
snore.
Yeah. How are we supposed to realize that we need to go check for sleep apnea?
So these group of people, because they stop breathing, their oxygen level is low, it will definitely affect their sleep quality. So during the day, these group of patients will feel really, really tired. No matter how long they sleep for. Oh, I slept 9 hours last night and I feel sleepy today. Or they might have some certain comorbidities, for example, high blood pressure, heart problem, diabetes. And, you know, this condition, when you stop breathing, when your oxygen levels go low, it makes your body kind of in stress, and your body will release some of the cytokines or, you know, enzyme hormones that raise your blood pressure, raise your blood sugar. So it definitely affects your quality, or I mean, your health overall.
So if you have these symptoms, go get tested right now. All right, today we learned so much, and we have a lot of listeners tuning in. Thank you so much as well. Thank you so much for educating all of us, Metsters, and of course myself. Thank you so much for your time today, Dr. J.
Thank you very much, DJ Carla.
ขอบคุณค่ะ
สวัสดีค่ะ
สวัสดีค่ะ All right, today, wow, a very interesting topic that I feel like it's really all around us about insomnia and sleeping. And today would like to give a very special thank you to Dr. Pojnicha Mekaroonkamol, Managing Director, Internist and Sleep Specialist at Integrative Care Center, Bangkok Hospital, and of course, Bangkok Hospital. You guys, next week, let's tune in some more to see what interesting topic Bangkok Hospital will be coming back with me. And for now, if you just tune in, you can also go back and rewatch the whole thing because Dr. J explained everything perfectly. But for now, hello, sawadee, to a healthier you, Bangkok Hospital is here. Everyone is unique and so is your health. Explore comprehensive healthcare services best suited for you and your lifestyle. Tailor your life and design your health at Bangkok Hospital, where advances in medicine meets with compassion.